All right. It looks like everyone is in. Hello, everyone. My name is Brittany Hawthorne, and we will get started on our Supplement Savvy webinar today. Today, we have our presenter as Joy, and she's part of our Diabetes and Health Education Department. She will talk about all her credentials and everything in just 1 second.
Okay. My name's Joy Midkiff, and I'm a dietitian. I have a lot of experience, and you can check out my credentials there. I like to work with people, helping them to have the best health. And sometimes that means using a supplement, and sometimes not. And so we have a big agenda today. We want to look at whether you need supplements, common supplements that are used, and how is the dietary supplement industry kind of monitored to make sure that what you get, think you're getting is what you get. And then could we get those nutrients from food? Are there some nutrients that we should try to get by a supplement? And I hope to leave enough time for you to ask any questions. Do put your questions along the way in the comment box, and Brittany is going to help us make sure that we get those answered. All right. When I think about this topic, this is kind of how I feel. I'm sure that some of you feel that way too. And this is a huge topic that it seems like every day there's something new to learn about it. And sometimes there's even conflicting information. So we want to be wise health consumers and seek out reliable sources of information and try to incorporate supplements, if you use them, into a healthy lifestyle, which you will find that any vitamin supplement is not going to be a quick fix, and neither is practicing a healthy lifestyle. So, for vitamins, there are nutrients that our body does not make on its own, and thus we need to obtain them from the foods that we eat or from a vitamin supplement. And they are essential for good health and many life functions. We're kind of being a little bit intentionally vague, I think, because we're talking about just vitamins. There's also minerals, and there might be herbs that people might take, and kind of lump them all together in supplement category. So I'm intentionally being vague on that. Sorry about that. And supplements can be in a natural substance that is extracted from a plant or animal source, or it could be a synthetic, man-made type of substance that your body recognizes as a suitable alternative. And they can come in a lot of different forms. Some people take them as pills, capsules, tablets. I called them waffles last time, but it's wafers. I've even had people tell me about patches that they worn, or things that you put under your tongue. And so there's gummies. Gummies could be in there too. We as a culture in the United States spend a lot of money, $35.6 billion. And most of us, 75%, are taking some kind of dietary supplement. We're kind of naive in thinking that we're getting good quality products every single time, and that quality can vary greatly. We're spending close to $100 a year for every man, woman, and child in the United States on something that may not be necessary. Okay, so our topic is how to be, now it's supplement savvy. And so you want to know how can you be a savvy person? And there's some questions to ask that can help you navigate in this world a little bit better. And one of the questions is, do you eat a well-balanced diet that meets your nutritional needs? Some people have some special needs. If you're following a strict vegan diet, you may not get enough vitamin B12, and that would be something that you would look as a supplement. If you're a smoker, you will need twice as much vitamin C as the normal person that's not a smoker. So for those of you who they consume excessive amounts of alcohol, and you have some increased nutritional needs for folate, B12, or not B12, but B6, thiamine, and vitamin A. And this may be because the excessive amounts of alcohol crowds out the foods that you would normally eat, or it could be the fact that drinking excessive amounts of alcohol costs nutritionally, and so you use up more resources. There are people that are drinking water that comes from a well only, and that might not be have enough fluoride in it, and so young children may need to have a fluoride supplement. Women that are of childbearing age need to have an adequate supply of folate, and also some of them need a little bit more iron because of the losses that they have monthly. So getting iron, adequate supplies of iron. There are people who have had surgeries on their digestive tract. Sometimes that's voluntary and sometimes not. And that may change your nutritional needs. Those of you who may have had bariatric surgery are going to need extra, like taking a multivitamin and calcium and vitamin B12 and iron, and have your doctor be monitoring your health long term for that, because your anatomy is a little bit different. All right. For the other gastrointestinal types of things, those and additional needs might need to be looked at individually to be more specific and for those needs. And then here, what if I'm following a strict weight loss diet and I'm consuming less than 1,200 calories a day? It is very, very challenging to get enough nutrients in less than 1,200 calories a day. And so this is a special population that would be vulnerable. Last time I checked, almost everybody is trying to lose weight. There is a small population that doesn't have that trouble, but most of us are struggling with the weight, and maybe have times where we're not consuming enough calories, or you follow a meal plan that is limiting in some food category, and the nutrients that category is rich in, you're not getting. Like whole grains, you might not get enough fiber. Let's go on here. Are you eating foods that are rich in the different vitamins and minerals? And we'll talk more about how you can figure that out here in a minute. If you're eating out, I know of people who choose very wisely when they eat out. They get a nice balanced diet. And then there's some people that are dining in less than optimal places, and you might not be getting enough nutrients. And so these are some questions to kind of do a self-evaluation. And then if you're a little bit older and you're struggling with your appetite, or you're having trouble chewing or swallowing, you might be limiting some of the foods that would be rich in various nutrients, and that could be a vulnerability. And then lastly is, and this is not the complete list there, I'm sure there's other factors to think about, but if you're taking a prescription medicine, some of those medications can change the way the body either absorbs the nutrients from your food, or the way that your body even uses the nutrients that you could get from food. And so what we want you to remember is that it's always good to talk to your medical provider when you're thinking about taking a multivitamin or a vitamin supplement. So let us move along. Should I take a multivitamin? If you are eating a well-balanced diet, it may not be necessary. If you're following the My Plate, and we're going to look at that in a second, that is set up, the recommendations for that, to cover all your dietary needs. That's how they kind of make those recommendations. And if you are taking a supplement, you don't want to think of that as replacing your food. I have talked to people and say, but I take those reds and I take those greens, and that will take care of all my vegetables. No, maybe not. Because there may be other components in the food that you benefit from besides the isolated vitamin or the isolated mineral. And so having the whole food might actually be where the benefit is coming from. So foods are probably the best way to go. So here's my plate, and we want to have at least half of our plate covered with the colorful fruits and vegetables. 1/4 of it being for your grains, and hopefully most of those are choices would be whole grains, because then we get antioxidants and get fiber from that. And then protein food, which could be from a vegetarian source or it could be animal sources. And then we have the dairy there representing really calcium-rich food, because 50% of the adult population is lactose intolerant and may not prefer to have any cow's milk source of dairy because it gives them gas, and that's not very pleasant. So let us move right along. There, when they do the research, food studies, intake studies to find out how are Americans eating to make the recommendations that go into something like My Plate, then they find out that most Americans are not getting enough of these nutrients, vitamin A, D, E, and C. We do get enough K, it seems. Folate, calcium, magnesium, potassium, which we're going to find in a lot of different colorful fruits and vegetables, fiber. And then women are especially vulnerable for not getting enough iron. And so these are, if you're going to take a vitamin supplement, these are some of the nutrients that you might want to say, do I have enough of these in my diet? So I've kind of been saying that getting the nutrients from food would be the best way, but there are still, sometimes you say, yes, I am a person that's not getting all those food groups, or I'm a person that's not getting all the nutrients, I don't think. And so I want to take a multivitamin, and it may help to improve your health and wellness and fill in some nutritional gaps. There have been people who say that taking a multivitamin is the cheapest health insurance a person could ever buy. I take a multivitamin. Most common supplements that people use are a multivitamin, calcium, vitamin D, fish oil, and probiotics. So those are common ones that are used. We have a little poll for you. We want to know what do you think? If you don't have vitamin deficiencies, it still can't hurt to take a vitamin supplement. True or false? Okay. It looks like most people said that they think that this statement is true. And in fact, the answer is false, because there are some nutrients that if you got too much of them could be harmful. And mostly that's for the fat soluble vitamins, vitamin A, D, E, and K, but also iodine, which is a mineral that we need in micrograms. And if we get too much of that, it can cause harm to your thyroid. So, there we go. Okay, so some particular nutrients that people might consider taking would be calcium. And usually people are doing that because they're looking out for their bone health, and their needs might change with age. Calcium should always be taken with vitamin D along with it. And then vitamin D, that is a nutrient I see when your doctor checks it. I've been here with Florida Health for about 6 months, and I can think maybe 5 people had their vitamin D within the normal range. And it's surprising because we are in the sunshine state, and it's the sunshine nutrient. So that might be something that you want to ask your doctor, how's my vitamin D level? And should I take a supplement? And it is a significant nutrient to help your immune system. Fish oil, in my time as a dietitian, we have gone on a roller coaster with fish oil and have at times told every single person to take a fish oil omega-3 fatty acid supplement. At this time, the people that are going to most benefit from a fish oil supplement are people who have had a procedure like having a cardiac stent placed and bypass surgery, things like that. And most of the rest of us are, they recommend that you eat your cold water fish like salmon, tuna, mackerel, things like that. twice a week, and you can get that need taken care of. If you're wanting to know if you are a person that would benefit, that might be a good question to talk to your doctor or your dietitian. Probiotics, this area of nutrition supplements is growing every day. They are finding new ways that probiotics on your microbiome, the good bugs that live in your gut, are beneficial to so many aspects of health. And it really should be its own topic. So I'm gonna move on. So as far as regulations, there are some laws, but dietary supplements are not regulated to the extent that pharmaceutical agents are. And FDA has the oversight, but they don't. This one doesn't get watched as carefully. And there's, told you it was $35 billion industry. So there's some people that are trying to gain that may not be looking out for your best interests. So if you want to be careful, be a wise health consumer. There is a risk that what you take as a supplement might have contaminants like heavy metals. It's possible there might be substances that you're allergic to in there, and they might not indicate that on the label. So you want to be really smart about this. And if you are to have an adverse reaction and you make a complaint, it may take a while for that to trickle down to having an item from the marketplace. We are not without some advocates, the watchdogs of dietary supplements. There are some heavy hitters here. Consumer Labs, they do a wonderful job of kind of spot checking on some suspicious characters and things like that. They have a free aspect to their website. You can get a lot of good information without having to buy a subscription. But if this is something that you're really interested in, it might be worth it to pay for a subscription to get into the more detailed information. There's also the NSF, which is the National Sanitation Foundation. They do a lot of inspections of the factory and the manufacturing side of things. USP, they are a big hitter on this. On the other side of our slide, we have what does it mean if something is USP verified? And this is a way that you're going to find out if the product that you're interested in maybe purchasing is kind of a reputable product, because they're going to check and see, does the product contain ingredients that are listed in the amount that they say is in the container? And does it have any of those possible contaminants? Like if I was going to take a fish oil supplement, I don't want to have any lead or mercury in it. And then does the company practice the good manufacturing standards as if they were a pharmaceutical company? And then the last thing is the form of the product that is being sold in a form that your body can actually use. There was once I had a patient who wanted to take oral calcium, and it was being advertised as this is the greatest, and it turns out calcium in that form isn't something the body could actually use, and so it was something that Consumer Labs actually busted, and so I was able to save that patient a lot of money by saying, you don't want to go there and purchase that. The Federal Trade Commission also is involved on the marketing side. If somebody, a company is saying that this product can do this and that, and really it can't, they're going to be monitoring that side of things. And of course, the FDA is involved too. That would be where you would report any safety adverse reactions to a product that you may take. These are some of the logos that you can look for on a package to see if that company is voluntarily submitting their practices to the standards, the industry standards, that are quite helpful. We have a list of some of these resources available, and you can reach out to us to get that list. All right. We have some highlights here. There's a lot of information on this slide, but here is the USP mark. And sometimes it's not as dramatic as that. They might just type the letters USP on the label. But that's a good thing to look for. And then this, when you're looking at a possible supplement, a multivitamin, for instance, if you see 25 to 100% of the daily value listed on the food label, that's a reasonable product. If you say something is like 7,800%, that's a little overkill. And do you need 7,000% of the recommendation? And that could be harmful for you. So kind of check out those numbers for percent daily value. That's based on what the general population would benefit from. The percent, that's what our need is. And then one more thing to pay attention to is the other ingredients, kind of what's the stuff stuck to. In particular, I have issues with red food dye. So I check, there's a capsule colored red. Is it red food dye in the ingredients, the other food ingredients? What if you're somebody who can't do, you have celiac and you need to avoid gluten? Are they using food starch for the substrate? And it's they have to declare that on the food label. So check that out for the other ingredients. Of course, there's lots of other information here, but we have to hurry on. So if you're going to do food to get those nutrients, there are some resources that you can go that have very nice lists for what are the foods that have what nutrients, or what nutrients can I get from foods, and how much do I need? And both of these resources are fabulous. The Linus Pauling is a 4-page document that lists each of the nutrients, what is the function in your body, what are the common dietary sources of that, and how much do I need of each of those nutrients. And what you might do with a tool like this is to go through the foods and circle for each of the nutrients the foods that you typically eat. And if you find that there's a nutrient that you don't eat any foods for, that might be something that you say, well, maybe I need some of these foods in my day-to-day eating, or maybe that's something that you think of as a supplement. I think that's a great way to use a list like that. And I've done that myself. I find for a while, I wasn't having enough dark green leafies, and I wouldn't be getting vitamin K. I wouldn't be getting folic acid. So I had to make a correction in my diet that way, because there's so many benefits that come from those foods. All right. So what if you want to check out some different vitamins and see what the benefits those are for your body? You're thinking about taking a supplement, but you don't want to take too much. So you could go to the office of, this is from the National Institute of Health. They have the Office of Dietary Supplement, and you can look up just vitamin D, vitamin C, or vitamin A. They'll have them all with a nice little article. And if you're a health professional and you want to have the science side of it with all the articles, the research articles that support that, you have a health professional version. And then they also have the consumer side. So shortened down a couple pages instead of 5,000 pages. No, it's not 5,000 pages. If you're thinking about herbal, so let's say you wanted, you're thinking about using a garlic supplement because you heard that it helps lower cholesterol. You could go to the National Center for Complementary and all integrative. They used to call it alternative, but it's integrative health. It's also an arm of the National Institute of Health. then that's where you could look up other herbals. And then the Linus Pauling Institute is, Linus Pauling is the one who discovered the vitamin C. And summer trends. Check that out. And we're going to have this on our resource list too. So we have a couple of vitamins that, we are getting close on our time, that are common for people to consider as a supplement. Vitamin A, we know, helps you keep your night vision, but it also can be helpful for your bones, healthy skin, keeping your immune system good. And we can get vitamin A quite adequately from foods if you're eating those foods. So animal sources and plant sources. Typically, we think of vitamin A as being from the orange types of foods like cantaloupe, carrots, sweet potatoes, but you can also get a lot of vitamin A from your dark green leafies. There's a typo. This says vitamin C, and it's a slide about vitamin A. All those foods are vitamin A, so I have to fix that. And then I can't leave supplement talk without talking about vitamin D. So the recommendation RDA for most adults is here 600, and then if you're over 70, 800, so 600, 800. But you'll see the daily recommendation over here is 2,000, and that's because most people are not consuming adequate amounts, and we're deficient, and we need to have a little more. And even though we're in the sunshine vitamin, 90% of Americans don't get this because there's very few foods. It's the sunshine vitamin. And if you are carrying extra weight, you don't absorb as much. And if you have darker skin, you don't absorb as much. So this might be something that you want to take as a supplement and talk to your doctor and find out if your level is low, because they might want you to take even more than this. All right, vitamin E. Vitamin E has lots of different forms, and we're going to get it in our whole grains mostly. Like wheat germ is a good source of vitamin E, and it's a powerful antioxidant. And so a lot of people take it to help heart health. But it is, some research shows that it might be also beneficial for your bones. This is one where if you're following a low carb diet, you might miss out on some of the foods that are rich in vitamin E. So that's odd. This slide says that vitamin E toxicity is rare, but I was just reading an article that possibly that could be incorrect. So I think most of the time, vitamin E is not toxic. Vitamin C, I do want to say that with vitamin C, it's possible that you can take too much, even though it's a water-soluble one that we typically pee out the extra from. If you're taking a dose that's more than 1,000, you could be putting yourself at risk for kidney stones. And you can get enough vitamin C from a very small 4-ounce glass of orange juice each day, or a piece of fruit the size of your fist. You can get it from onions, broccoli, cantaloupe, things like that. Strawberries are a good source of vitamin C. You don't need to take that as a supplement. But if you did, 250 to 500, that's the most I would take. And then, if you haven't figured it out, food first, whenever possible. But there might be some situations where a supplement is worthwhile. So, okay. Well, then I want to tell you where you can get more information down the road. You can email the Wellness Center at floridahealthcareplans.com. You can also, if you have Florida Healthcare as your insurance, you can call us at 386-676-7133 and set up an appointment with a dietitian. You don't have to have diabetes to make an appointment with us. And you can make you can self-refer. You can ask your doctor for a referral, and you can see a dietitian for any reason as many times as you need, and there's no copay. So check out our website. We offer a lot of classes too.